The goal of this video is to give you information on medications that are commonly used for detoxing individuals from alcohol and opioids. As well as medications that are used to treat anxiety and depression. It's important to know about the medications that you are taking and understand the role that these medications play in your time at high point. Alcohol detox. When a patient is going through an alcohol detox, there are a variety of signs and symptoms associated with alcohol withdrawal. These include agitation, increased sweating, increased heart rate, palpitations, hand tremors, gastrointestinal upset, insomnia, headaches, and an inability to eat. There is a clinical assessment to decide how to support the patient. It is called the CIWA-AR, which stands for Clinical Institute Withdrawal Assessment for Alcohol Revised. The main medication class used in alcohol detox is benzodiazepines, or benzos for short. There are many different kinds of benzos, and they are used for reducing anxiety, helping with sleep, and helping with muscle spasms. However, for detox, they are used because they affect the same pathway in the brain as alcohol. It is dangerous to stop alcohol cold turkey because it messes up this pathway and could cause death. Benzos will help with a smooth transition out of alcohol dependence. For a standard alcohol detox, the main medication used is Librium. Librium is a long-acting benzo which is more effective in suppressing withdrawal symptoms and in producing a gradual and smooth detoxification. Other medication options. For patients who are allergic to Librium, who have liver impairment, who are over the age of 65, or who are pregnant, there are other medications you could use instead that are similar to benzos. These meds help reduce anxiety, improve sleep, and prevent seizures. For example, Serax, phenobarbital, and Ativan. The specific medication prescribed, along with its dosage and administration frequency, is determined based on individual patient needs. Opioid detox. Signs and symptoms of opioid withdrawal include a runny nose, watery eyes, dilated pupils, goosebumps, and diarrhea. Other symptoms that patients may describe include bone pain, flu-like symptoms, and abdominal cramps. For opioids, the COWS assessment is used. This stands for Clinical Opiate Withdrawal Scale. It is used to determine the appropriate time for administering medication. For standard opioid detox, there are 3 main medications which include the following. Clonidine. Clonidine can be used for many things, including treating high blood pressure and ADHD. This is also effective in reducing withdrawal symptoms. The second medication is Subutex. This is the trade name for the drug buprenorphine, which is a partial opioid agonist that reduces cravings for opioids. The third medication is methadone. Methadone is a long-acting opioid that does not cause euphoria in the way that other opioids do. Both Subutex and methadone can be used to wean a patient off other opioids such as heroin or fentanyl. Anxiety medications. When someone goes through detox, anxiety is a very common symptom. Anxiety is often best treated with non-pharmacologic interventions such as therapy, relaxation techniques, exercise, and other skills-based treatments. Sometimes medications are used to help treat symptoms of anxiety. Depression medications. Antidepressants are commonly prescribed medications for treatment of depression and anxiety. They work by influencing the balance of various neurotransmitters in the brain, helping to improve mood and reduce symptoms of depression and anxiety. Here's an overview of some of the most commonly prescribed classes of antidepressants and anxiety medication. The first medications I'd like to discuss are bupropion or Wellbutrin and mirtazapine or Remeron. These medications work differently to enhance access and transmission of various neurotransmitters in the brain and reduce depression. As with any medication, side effects can occur. Bupropion may cause poor sleep and anxiety, while mirtazapine side effects may include increased appetite, weight gain, and sedation. SSRI medications. SSRI stands for Selective Serotonin Reuptake Inhibitors. SSRIs work by increasing serotonin availability in the brain, which can help improve mood or depression and reduce anxiety. SSRIs are most commonly prescribed for treatment of depression, anxiety disorders, and other conditions like OCD and PTSD. As with any medication, side effects can occur. SSRIs are generally well-tolerated medications. Some common side effects may include nausea, poor sleep, sexual dysfunction, weight gain, and dry mouth. These are generally mild and resolve after a week or two. Common SSRI medications include sertraline or Zoloft, escitalopram or Lexapro, fluoxetine or Prozac, citalopram or Celexa. SNRI medications. SNRI stands for serotonin norepinephrine reuptake inhibitors. These medications work by increasing the availability of serotonin and norepinephrine, helping to balance mood and ease anxiety symptoms. Two of the most well-known SNRIs are venlafaxine or Effexor and duloxetine or Cymbalta. SNRIs are commonly used to treat depression, anxiety disorders, and even chronic pain conditions like fibromyalgia and diabetic neuropathy. As with any medication, side effects can occur. These may include nausea, dizziness, increased blood pressure, insomnia, and sexual side effects. Fortunately, they're often mild and tend to subside after a couple of weeks. The next type of medication is buspirone, also called Buspar. Buspirone partially activates as a specific serotonin receptor, which helps regulate serotonin levels in the brain. And in this way, it acts as an anti-anxiety and antidepressant medication. It may take a few weeks before its effects are evident. Antihypertensive medications. Now I'd like to discuss antihypertensive medications. These medications are traditionally used to treat high blood pressure. However, they have additional benefits with anxiety symptoms. There are two types of antihyperintensive medications. The first type are beta blockers, also called propranolol. Beta blockers block the physical symptoms of anxiety, like rapid heartbeat and trembling, helping to reduce the physical experience of anxiety. The second type of antihyperintensive medications are alpha-2 adrenergic agonists, also called clonidine. These help reduce neurotransmitters associated with anxiety and may produce a calming effect. Antihistamine medications. The next type of medications I will be discussing are antihistamine medications. These medications work by blocking histamine receptors, resulting in a temporary calming effect, and may be sedating. Two common antihistamine medications are hydroxyzine or Vistaril and diphenhydramine or Benadryl. If it is determined by your healthcare practitioner that treating your anxiety and/or depression is indicated, they will help determine which medication is most appropriate for you. Each medication type has its own set of potential side effects, which would be discussed with your healthcare practitioner. The choice of treatment depends on the individual's symptoms, medical history, and response to different medications.